Okay, welcome to Chapter 2 of Ethics. Today we're talking about values and emotions. We'll be beginning from our textbook, Ethics for Massage Therapists. We'll start on page 9 today. Excuse me, I just took a migraine tablet and it was bitter. Okay. So values and emotions, chapter 2. All individuals have their own values, beliefs, and morals. We have similar beliefs about many things, but there are also significant differences among people. In the previous chapter, you saw why people's beliefs and values vary and gained a better understanding of how your own beliefs, values, and ethics developed. Because you personally own and take pride in your beliefs, you naturally are often emotional about them. So beliefs and feelings. When you believe in something, it's only natural for you to believe it's true. But as we saw in Chapter 1, beliefs are not the same as facts, and two people can have different beliefs about the same realities. In most issues involving beliefs, there's no simple answer, no facts that definitively prove either side's position. When our emotions are involved, we tend to take a stronger stand on what we believe. The issues become more personal, and we can be reluctant to listen to others who believe differently. Strong emotions can have positive effects when they motivate individuals to act as they believe, but can have negative effects when they get in the way of understanding another person's beliefs and feelings. Clients who disagree with our values, beliefs, or ethics most likely would have reservations about becoming a client. A client who is not comfortable with how you act, talk, or behave may not feel comfortable working with you as in the massage setting. Learning to accept diversity and working with clients in a professional manner is part of being a successful massage therapist. It is important to respect the differences between you and your clients. Communication between client and therapist during a session is very important. Checking in with clients on pressure and pain levels and addressing issues pertinent to the session are important aspects of the therapeutic relationship. Talkative clients, we tend to have clients from time to time that are very talkative. It may just be that they're nervous, or they may be friendly, or they may be trying to avoid issues that come up through the body work. Listening to a client talking about personal beliefs or other matters may start the therapist thinking about his or her own beliefs, resulting in a loss of focus on the work being done. It is then important to be aware of what is happening and redirect your focus back to the session. Bring the client back to focus on the session through an emphasis on breathing and talking about the goal for the session. It is important not to start talking about your own feelings and beliefs during the session, especially on topics that have nothing to do with the session itself. Key points: strong emotions are often attached to beliefs. Emotional reactions can harm the therapist-client relationship, and professionalism helps avoid conflicts. Your own feelings. You may have concerns about certain massage techniques. For example, some students may not imagine having to massage someone's feet. Most schools teach massage techniques for the feet, as do we. Some even incorporate reflexology in the zones of the feet. Some students may hope they can get by in their practice without working on a client's feet, but for many clients, having their feet worked on is one of the best parts of the massage. Think about your feelings for a moment. Do you personally not like to have your feet worked on? Or is it that you do not like touching another person's feet? Do you therefore assume everyone else feels the same? Or maybe you have ticklish feet and it's difficult for you when someone touches them. Or maybe you fear encountering a fungus from a client's feet. You can see how the emotions associated with such beliefs can be problematic when giving massage. You want to make sure that you are doing your best to keep your personal beliefs out of the massage room when it comes to situations like certain body areas or certain body images. As I've said before, and you'll hear a million times over, by the time this course is done, by the time the program is finished, you will literally see this chart of the muscular system instead of seeing your client to an extent. You start trying to train yourself to think of what muscles are laying there and what muscles are hypertonic or what muscles have trigger points within them. You stop thinking about, oh my God, I'm working on someone's feet, and you start thinking about the plantar fasciitis and the plantaris muscles, or whatever, you know, the situation is, whatever muscle you're working on versus the specific area that you may have problems with. Another one besides feet that students tend to be a little iffy about when they first start working it is the glutes. The glutes is a group of major muscles that are very important in being upright and even walking. So these are major muscles. These muscles are affected constantly, and we do massage them. You'll be trained, you know, and you won't be thinking of it, oh my God, I'm massaging someone's butt. You're going to be thinking about, okay, which direction does the gluteus medius fibers run in? Okay, now which direction does gluteus maximus run in? You're going to be thinking more about the muscles than the actual body part. So that helps. Work through your own concerns will help you better understand and work with your clients. Some of your clients may have very same concerns that you have. Many details of massage are very subtle, and receiving a massage will help you feel what those little details are and why they may be important to a client. Clients will also report what they did or did not like about the draping or the environment of an office. Therapists may not realize how noisy an office is, or that the draping was not tight enough until someone brings it to their attention. It's very important as massage therapists and even as massage therapy students for you to be getting massage therapy on a regular basis. You need to be practicing what you preach. You need to receive massage in order to be able to do a good massage. Because there's so many times that you will learn you'll learn new techniques, but you'll also learn certain things that you do not like when you're receiving a massage. And you'll learn that things don't feel exactly the way you thought they may when you receive that touch yourself. Now, obviously, we can't feel our own work, but receiving massage from various other therapists and other students will help you to benefit from that. Sorry, close that door real quick for us. Okay, on page 11, it says working with your clients to address their concerns and meeting their needs is a very important part of being a massage professional. Massages received from professional as often as possible are a valuable learning tool. What we were just talking about a little bit. And actually, one of the main reasons this whole school exists is due to the fact that every time I went to get a massage here in Tuscaloosa, it seemed very unprofessional. It was never what I had requested. It was never deep tissue if I was requesting deep, or it was too deep if I was requesting Swedish. It was therapists not checking in with me on my pressure. They were kind of just doing what they thought, what they wanted to do, or maybe what they were trained to do. I'm not really sure. So it's very important for you to be receiving massages because it helps you to kind of determine and put yourself a little more into the client's aspect of it. Excuse me while I get a drink. So exercise 2.2 and 2.1. Sorry, we haven't done 2.1 yet either. But go ahead and do exercise 2.1 and 2.2. Those are asking you a couple of different questions. Go through, take the time, pause this video now, and do those exercises. And again, I would do those on Microsoft Word or something and just do one thing for the whole chapter. Just make sure you label which ones are which exercise. And then we will pick up with the client's feelings. Okay, so the client's feelings, we're on page 12 now. Generally, two types of individuals receive massage. The first have few, if any, reservations about receiving body work. They received a great deal of work in the past, and they have no hesitation calling to make an appointment. Even with experienced clients, however, do not assume that the feelings will always be positive. For example, you have a new client who does not seem shy about receiving massage. You begin work on her and everything goes well until you do some work on the upper leg and the gluteal area. You suddenly notice she is tensing up. You talk with the client and she tells you she does not like to be touched in this area. Possibly you are the first massage therapist to work this area. And believe it or not, yes, many times you will be the first to work the area. Even if they are regular recipients of massage therapy, I've found, especially in this area, a lot of times massage therapists do not work the glutes and they do not work the abdomen. That is two of the main areas, and you will be working those. Not necessarily every client every time, but you will be working those. Let's see. So back with our book, communicating with clients about what you're doing is necessary, telling them what muscles are involved and why the work you are doing will help alleviate a symptom or problem. It's important to leave room for the client to communicate with you. If the client continues to feel uncomfortable, you just tend to leave that area alone to show respect for the client's concerns. A therapist should always be conscious of a client's reactions to the work and work only within the client's comfort zone. Other clients, typically with little or no massage experience, may be apprehensive about someone touching or working on them. Clients experience a wide array of feelings about what is appropriate in touch therapies. Some may feel uncomfortable disrobing for massage, while others easily accept this. Some may and should feel that certain areas are out of bounds and should not be touched or worked on by the massage therapist. And some states have laws and regulations stipulating what areas are not to be touched, but the client's own feelings about the areas of their bodies are equally, if not more important than any state regulations. Moving on, signs that clients feel uncomfortable with a particular technique, pressure, or area being worked includes muscles tensing in other parts of their body, pulling the drape more tightly around them, fidgeting on the table, making a fist, holding their breath, talking nervously, or bouncing their foot, kind of shaking their legs. These are all signs that you can watch for that a client is uncomfortable, whether it's they're in pain or whether they're having a little apprehensions about this specific area that's being worked. And you always respect the client's feelings and their privacy. Ultimately, it comes down to if the client is not comfortable with it, you do not do it. Even if you know that they need that area worked. Maybe future sessions you can gain enough confidence or enough trust from that client to be able to do the areas that are needing the work. Okay, as a professional body worker, you need to watch for these signs and communicate with the client to correct the situation. Even when asked, however, some clients may not feel comfortable telling you what is wrong. You have to respect that and do not pry. You do want to try to suggest stopping the work in that area or moving to another area. If you do not pay attention to the signs or discomfort, or you fail to check in with the client may not return for another session. Oftentimes they don't even tell you. You have to kind of pick up on these little subtle clues to know what's going on with your client. A lot of times they're not even able to identify what they didn't like about the session or what they didn't like about that specific area being worked. We'll go into that a little bit later on when we are doing our psychology courses and stuff. but they just know that they didn't like it. They had an unpleasant feeling when you worked a specific area or when you did a specific technique, but they don't really know why. When we get into psychology, we go into discussing what those issues could be. Okay, so touch is necessary for survival of infants, and it becomes associated with feelings of love, safety, and happiness. This is some of the psychological positive aspects of touch. Touch is important for growth and development, but touch can also affect development negatively, such as when a child is punished by being slapped, spanked, pinched. Abusive touch can result in emotional scarring. And then touch can promote emotional as well as physical healing. So touch is very important. Yet, as we have seen, touch can be perceived as threatening, intimidating by some clients, depending on their past experiences and their feelings. It's crucial for us as massage therapists to understand the possible dynamics involved in a client's feelings. And again, we go into that in psychology than we do in ethics, but we do touch a little bit in it later on in ethics. So read over the case study at the bottom of page 13. And then your key points. Clients have different feelings about certain body areas. It's important to understand the apprehension clients may have and respect the client's feelings and privacy. Massage therapists should attempt to understand these aspects of their clients, their beliefs and values involving the roles and motivations, including if the client should take an active or passive role in the therapeutic relationship. Should the therapist only help to facilitate the client's progress or take on a more authoritative role in the relationship? Also, a client's expectations for the massage session may be consistent with or vary widely from the therapist's expectations. And the client's personal history of both massage therapy and touch in general strongly affects his or her present attitudes or expectations. And again, it's not for us to judge a client ever, and it's not for us to pry into what may or may not be causing these feelings or emotions. So here we have a little picture that's from your book over on page 12. The therapist is thinking this will really help her, and the client's thinking, oh my God, what is she doing to my stomach? You know, that's very typical of us with massage. We tend to think, oh, this is going to help so much. But if we don't verbally express that and express why and how that's helping, the client's just laying there thinking, oh my God, no one's ever massaged my stomach before. What is she doing? Why is she doing this? Is this normal? Is this safe? Is this professional? Is it ethical? You know, it's all these questions going through the client's mind. So it's important to always communicate with your client. Okay, working with the client. First up, we have ethics and trust. So whenever you provide a service or product to the public, they expect it to be presented in an ethical way, of course. Word of mouth is one of the most common ways that an individual becomes a client. We're talking about how we typically get clients. People ask their friends, their family, and co-workers about massage therapists that they have seen, and they usually trust these people to let them know who they can begin to trust as a therapist. Trust is a very important issue in the massage community, obviously. You're asking clients to take off some or all of their clothing and have you touch parts of their body not usually touched by strangers. If at any time the client begins to feel unsafe, the client usually becomes very emotional or feels threatened. Clients who feel unsafe are not having their needs met and likely will not return for another therapy session. You cannot assume clients automatically know that you have only good intentions in mind for their massage. You have to earn their trust. Clients expect you to act ethically according to their way of thinking, not necessarily your way of thinking. So it gives the example, Do you know precisely what a client's safety zone is? As discussed in Chapter 1, there are many differences in people's beliefs. Assuming that you always know what is good for a client can lead to problems in your practice. So you never want to assume. So take a moment here, do exercise 2-3, and then come back and we'll continue on with emotional safety. Okay, with emotional safety, remember that because of their past, your clients may have issues with certain aspects of being touched, and it is important to respect what feels right to them, not necessarily just like what you're trained to do or what you are told to do or what you feel is best. You've got to do what's best for the client, and ultimately it is earning their trust. Clients may choose not to tell you they have issues with parts of their bodies, or they may not even realize until you start working on that area that they have issues with those body parts. And you want to always go back and again, watch for the fidgeting, watch for the excessive talking, watch for them clenching their fist or even their jaw sometimes. All of these give you indications that something is going on. Okay, trust is a very important issue in the massage community. We talked about that, talking about, I am so lost now, I'm sorry. Someone just knocked on the door and I am completely lost. Okay, so we're talking about emotional safety. Whether or not the client chooses to tell you they have issues or if they even realize that they have issues. First, it helps to be as informed as possible about the client's likes and dislikes through your intake form and the interview. In your intake form, that is the form that the client fills out, giving you information about their history, their medical conditions, their contact information, things that we as their healthcare provider need to know. And there's an example of the form on page 17. Second, once a client has expressed a concern, either by saying something or by reacting in a way that you notice, it is your responsibility as the professional to be proactive in respecting the client's feelings and wishes. If you ignore the situation and proceed with the massage, the client could feel that you've crossed over his or her personal boundaries. The client needs should always be the focus of the session. Even though the client may not always be aware of what those needs are at the beginning of the session, that's still the main focus. And it gives the example if the client asks you to address low back pain during the session, but then you're working on the area and they begin to seem uneasy. It's best to check in with the client and assess whether work should continue in that area or if you should move to a different area. Also, time and experience help a new therapist begin to feel more comfortable with not having to think about every variable of the session. So there's a lot going on in the session, a lot you're having to focus on. But again, with experience, and hopefully you'll get some of that in school. You're not going to have everything. You're not going to be down pat and everything with the program, but we are an 800-hour program, and we do require 100 massages on the public, plus massages on each other, in addition to homework massages, where you'll be doing massages every week on family or friends. So we try to give you a pretty wide base of experience to stem from, but even still, there's issues that come up with me 14 years later, past school, that I still have things that I'm like shocked by and stuff. So it's very important to be able to understand that with time and experience, you'll feel more comfortable. But at the same time, even with time and experience, you still need to be on your toes and you still need to be paying attention to what's going on in the room, specifically what is going on with your client's body, with their muscles. We go into, again, later on, we'll talk about emotional releases and different things that go on with the client, as well as transference and then counter-transference. And all these you'll get more and more familiar with as we go along. Next, we'll talk about communication. So before the first session begins with a new client, A professional massage therapist should know what the client's expectations are and any issues they may have. There's several ways you learn this: through initial contact, that's when the client calls; through the client intake form, that's the sheet they fill out; the client interview, that's typically where you sit down and you talk with the client. It can take anywhere from 2 to 3 minutes up to 15-20 minutes. You sit down, you're explaining the form, you read the disclosures the client should sign. Typically us here at the school, we typically leave the client and let them fill the form out, and then we come back and we answer questions and we ask questions pertaining to the form. Some people actually sit down and fill the form out with them. That's another option that we may be going to shortly, as we're about to implement a new system, where we'll be doing more electronic files. And once we do the electronic files, you'll be doing more of you'll be actually there with the client filling it out for them. The time it takes to interview the client can depend on their current health. Again, a wellness session, you may spend 2 minutes. A medical massage or a clinical session, it could take, therapeutic session, whatever term you want to use for it, it can take upwards of 15-20 minutes. Here at the school, we try to keep things short and brief just so we get to spend more time actually working on the client. But that client interview is very essential part of the massage therapy process, so it's very important that you are very thorough with that. Okay, next up, it's talking about careful observation and focus on the client. Therapists should pay close attention to the clients from the time they walk in the door until they leave. When you greet them, you'll already be getting a general sense of what their state is. If they're having a rough day or if they are apprehensive about receiving the massage, you'll be able to see these emotions, and if you pay close attention, you'll be able to determine, a lot of times what is actually going on with clients. During the massage, keep observing the client for any signs of distress, such as the tensing up, the bouncing the foot, fidgeting on the table. After the session, you'll tell the client you're leaving the room, instruct them to get up slowly in case they feel a little dizzy or lightheaded, and explain to the client how to get off the table. I typically go ahead and remove the bolster from the table so that it makes it a little bit easier for them to get up off the table. During the session, if you have suggested that the client stretch in a particular area, after the session, that's when you will want to show them how to do that or provide information on the stretches. So anytime you don't ever just tell them to stretch, you have to show them how to stretch. And so now let's pause a second and do exercise 2-4. You're writing a script explaining the massage routine to a client. And practice your script so that you can follow it without notes. And also present your script to the class. Use props as needed, such as a massage table. Obviously, with the online portion, we will not be doing this unless a couple of you want to get together and practice back and forth with scripts on each other. And if so, that's great. You can either contact each other or you can contact me, and I can pair you up with either myself or another student to practice that role play a little bit. Okay, also our next topic on working with the client is the characteristics of success. Successful body workers will tell you that treating clients ethically is one of the most important features of their practice. Following are some additional important components for having a successful relationship with your clients. Number 1, you want to professionally communicate with your clients. Number 2, you want to note that it is your responsibility to ask for information that will help you treat the clients effectively. Number 3, if a conflict does arise, address it immediately. If client is visibly upset, ask about it right away and try to resolve the problem. being sure to respect the client's rights and feelings and not pry into their personal issues. Number 4, be proactive. So gather your information. You need to treat your client. Number 5, when in doubt about the client's needs, ask your mentor in your field for help. Always be sure to respect privacy when doing that. HIPAA laws forbid us to disclose any client information to anyone, even to our mentors. You cannot disclose their name or any identifying components of the client. And then number 6, always keep the client's safety and trust in the forefront of your thoughts. So key points there are the client's trust in a massage therapist is crucial. Your massage practice should feel emotionally safe for clients. Effective communication clarifies the client's expectations, and clients will trust a therapist who works towards their goals in the massage session. And this is a picture of that intake form. Ours is a little bit different here, but this gives you an example. And then in theory and practice, massage theory and practice, you will be going specifically into how to do an intake form and interview and all that. Key terms, you have safety zone. This is the client's physical and emotional areas that the massage therapist may touch without provoking anxiety or negative emotions. An intake form. This is the form used in massage therapy practice with clients to provide basic information as well as their goals for the massage. And also, in summary, be non-judgmental and flexible as you work with clients and their different beliefs and values. So that ends Chapter 2. We'll pick up next session with Chapter 3, your Code of Ethics.